Here we go. There we go. So we were talking a little bit. So my background is in dentistry. I've been in private practice for 25 years with the same dentist. And there are lots and lots of procedures that I personally love. But doing the infographic, I chose one that it seems very popular amongst patients, and it gets discussed almost on a daily basis in the dental office. So I just wanted to put together basically what are generally the top 10 questions that I'm asked. So they just seem to be reoccurring questions that people have. And so I thought, let's put them into a little infographic and have a little discussion about teeth whitening. So just out of curiosity, although I can't see Steve's picture, have any of you ever used a tooth whitening product excluding toothpaste? So have you ever whitened your teeth?
Yes.
I recently got trays made, like last week I got trays made and I used it for the first time ever. So I did.
Okay, so you had custom trays made then.
Yeah.
Fantastic. And Joni, you said you have whitened, and what type of product did you use? If you don't mind sharing.
Those strips.
Like Crest White strips, that type of product, and over-the-counter product. Yeah.
Right. That's right.
Perfect. Yep. All right. Well, so we will talk a little bit about these. These are two products, both products that we're going to address today, as well as professional in-office whitening. So we'll kind of look at all of them. So here we go. And I just have to move there and over. So generally, people are usually wanting to know if they are a candidate. So their main concern is whether or not they qualify or that they can go ahead and whiten to begin with. So the main things to take away on, and you would know because you've done this, so you might have asked this question. Mostly it's just, we would recommend from a dental professional standpoint that you have a dental exam. Just to make sure that your oral health is in good condition. And if you have any cavities or fillings, any caries that need to be addressed, you should have those done ahead of time, for the reason that we can't whiten teeth that have decay on them. So if you have an active caries, we would have to address that before we could proceed with whitening. And the other thing we generally recommend is that people have all of their, Carly, did you just ask me if I could hear you?
No.
No.
Steve just asked.
Oh, okay. Sorry.
I don't think I could hear him.
But his mute had been on, but I noticed it came off.
Okay.
So I'm not sure if it's back on, but I couldn't hear him right now. But he doesn't have audio or video either on my screen. And usually we only whiten people with all their adult dentition. So we generally recommend them 16 years and older. So as long as these criteria are addressed, then we are good to go with the whitening procedure. All right. The next question generally people want to know is it safe? And you hear a lot of people wonder if there is going to be long-term damage or effect to their enamel. So the answer mostly for this one would be yes, it's safe. And with that, you always put that little disclaimer that everything should be done in moderation. So there isn't going to be harm to the enamel. That's this long-term, long-lasting effects that are going to, cause you problems in the future. However, there are people who over the years, we've had to tell them that they need to stop whitening because they whiten like for 11 months out of the year. And so if they're whitening that frequently and they're only taking like the odd few days off every month, that's just too much. So just like any cosmetic procedure, we do want to know that there's probably a limit. And so you just need to keep it in moderation. But the whole process, as far as any of the ones like Carly or Joni were talking about, an over-the-counter product or anything through a dental office, is going to be safe because you're getting the proper products and not something, we don't usually recommend the ones that there's mall kiosks and tanning salons I know offer whitening products. Those won't be ones that I discuss because they wouldn't be ones that we would recommend from a dental professional standpoint. And Steve's still having trouble because he made a little angry face on his screen. So
We'll tell him to hang in there.
Yeah. I'm pretty sure he can still hear us, but we'll talk to him here.
Okay. You just let him know. So then, oh, now he's got sunglasses on, so he's chilling out, baby. So as far as the next question is, how does it work? So in a nutshell, like Carly was kind enough to give us the little alveoli and the little the very brief description, so we didn't have to go into a lot of anatomy on lung development and the way they run. Very briefly, the whitening agents are basically containing the gel or the active whitening ingredient. So the solution that you're using is going to combine with the oxygen in the air and the carbon that's in our dentin. And the dentin is the next layer under the enamel. So the carbon is released through with those active whitening ingredients. It'll come through, and then oxygen is involved because we're, hopefully our patient's mouth is open and they're breathing. And then basically that's going to activate those whitening solutions. And then that removes the stain. So whatever stain is on the teeth, and of course we're talking about extrinsic stain. So we're only with a whitening, these whitening methods are only dealing with the stain that's built up on the surface of the tooth. Internal bleaching and whitening and intrinsic stain from trauma is a completely different procedure. So not what we're looking at today. The most common ingredients when they're working that we were talking about that are going to be activated, the most common ingredients are hydrogen peroxide and carbamide peroxide. Those are the two that you'll see on most whitening products, if not all. Other ingredients that you'll often read as being listed on your gel are potassium nitrate, which is really great when that's in there because it helps reduce tooth sensitivity. And also you'll see some composition or component of fluoride present in there as well. And that's just to promote like tooth health. So those are the reasons, and those are the main ingredients that you're kind of looking for. And those are the key ones. Good so far?
Yes.
We're all in there, and Carly can't wait to whiten more now.
I know, right?
Oh, absolutely.
Carly's like, I have trays and now I'm
I
ready
know.
to go. So what options are available for tooth whitening? In these options, like I mentioned before, we're going to look at the ones that are the professional in the office whitening, the take home, but professional take home, which would be like Carly had purchased, and over the counter products. So those are the ones that we'll just talk about briefly and just see what the differences are between them. So these images reflect two both the professional line. In this image here, where the tooth, you see the teeth, red gel, and the green on the gingiva. This is a professional in-office system. So what's happening here is with the professional in-office system, patients arrive and you will usually have the procedure completed in 1 to 2 hours. And what happens is that the dental care provider will apply this green barrier. Well, it doesn't have to be green, but in this case it is. This one is specifically called Opal Dam. This is applied to the gingival margin and it covers the gingiva to protect it from the gel. In professional in-office whitening, you are receiving the highest level or highest percentage of active whitening ingredients that you would get. You won't be able to purchase these and use these at home because it's given and done under the care of a dental care professional. So in this case, this particular gel is the one that we use, and this is a 40% hydrogen peroxide, so very, very high. Then you're going to apply this, and basically in 3 stages. You can do minimum of 2. Each stage is applied, each gel is on the teeth for 20 minutes and then removed, and then another layer put on, and another 20 minutes, and then again another one. Usually we go through the full 3 systems, but there are some people who are happy with their shade after 2, and then they can choose to not do the 3rd, but it should be done with the 2 minimum. So again, this professional in office then is going to give you the highest concentration and in the quickest amount of time, right? Your whole whitening procedure will be done in 1 to 2 hours. In the other system below that is what Carly has, custom trays. And so this would be a professional take home system. So this professional system, like Carly shared that she just had made, you come into the office and they can do a digital scan or impressions where they get professional trays made for you that specifically fit your dentition and your teeth, nobody else's. So they're custom. And those trays really would fit forever as long as you have no major changes to your teeth, right? And then this person in the bottom and holding that tray has a small little tube you can see there, and they're applying a bit of gel into this tray. So when you're doing that, the professional take home in these situations, they can have a variety of different types of percentages, but again, they're going to be higher than what you would get in over the counter, so not from a drugstore, but they can range depending on whether they're carbamide peroxide or hydrogen peroxide. They'll range in percentages, but somewhere around like 10, 15, 20, 25, maybe 30, depending on what which ingredient it is, hydrogen peroxide or carbamide. The system to the right is also a professional take-home kit, but it is just a disposable tray. So you don't have to have the impressions made. So you can see the before picture, it's just like a very clear, flexible tray, but after it's been on the teeth, you can see your impression of your own teeth kind of coming through there. And you're just wearing that for about a 15 to 20 minute, maybe 30 minutes if it's not very high concentration. The same as the trays that Carly has, which were in the corner. You're usually wearing them anywhere from 15 minutes to 30 minutes. Again, just depending on what the percentage is. So the whitening in general with these systems, usually you're going to whiten anywhere from 5 to 10 days. It just depends again, like the height, the strength, and the percentage. So 5 to 10 days, wearing these for half an hour maybe at each time versus a professional in office where you'd be all done in 1 to 2 hours. All right, next slide. This slide just gives you an idea on some of the percentage of the whitening agents per product. And these change still. There's been changes already, I find. So professionally applied in office, like the one I had in the red gel, is a 40% gel that we use in the office of a hydrogen peroxide. Most in office, if you're using carbamide peroxide, there'll be about a 35%. Professionally dispensed, like the ones that maybe Carly purchased, or even those ones I showed you, the disposable ones, you actually can get them higher than the hydrogen peroxide can come higher now. They've formulated it. The one we have in office is 15%, and carbamide peroxide is usually around 16. But again, there's some that are developing constantly that are increasing the percentages because they kind of put other ingredients in just to minimize some of the tooth sensitivity, which is really key, right? And that people aren't gonna hurt themselves at home. In the over-the-counter products, you will find only, usually it will be a maximum of 10% hydrogen peroxide, no carbamide peroxide sold in stores that I'm aware of. And again, the difference really will be that these ones are just going to take you, an over-the-counter might take you 5 to 21 days. Like you might be wearing it, depending how white you're trying to get, you could be wearing it for 3 weeks, that whitening consistently and on a regular basis. Whereas with the professional dispensed materials, usually 5 to 10 days. So, all right. How much does it cost? Well, that's kind of an open variable. So obviously the over-the-counter products would be, if it's Oral-B's, like, which is Crest White strips, I mean, they're going to set their own prices more or less. As far as the dental professional, any ones, whether we're in office, the 1 hour or the 2 hour in office treatment, or the products like Carly would have purchased some, a little kit maybe, and it has some little syringes with it. The dentists can pretty much, there's so many products available, and you can buy in bulk and it saves the patient money. So it does vary. Generally, rule of thumb, I would say that the in-office, the professional in-office treatment will likely be the most expensive way to go, because you're also having to have a dental care provider in that mix too, that needs to tend to you, and obviously then they're being paid, right? So that's going to be factored into the cost. And then I would say that your take-home trays, like Carly had custom made, would be the next most expensive. And the products like I showed you that are the disposable ones, would any type of in-office, but not that you had to have made specially, would be the third expensive. Ours, just for, like general sake, right now, in-office whitening is on for $325. It's on $100 off for the month of May. So it normally is $425 in our office for the in-office. But you do also get sent home with 5 days of the whitening gels, like the little disposable ones that I showed you. You get to take home another 5. So you'll continue whitening. And the ones that are those ones, those little disposable ones, they run about $10 a day. So if you buy 5 days to just do 5 days, it's $50. It's $100 for 10 days. So that's kind of the ones that we're selling at this point. That's kind of the pricing where it is. Does it hurt? Oh yeah, everybody always is worried about it hurting. So I would say in general, that there is going to probably be some temporary tooth sensitivity. That's common. That's nothing to be alarmed about though. Nowadays, because of the potassium nitrate, like I had said, put into the whitening gels, it does reduce tooth sensitivity. The key really is to use probably a toothpaste that is recommended by your dental professional. We would recommend using Sensodyne products after whitening. So just to help reduce that tooth sensitivity, make sure it's a white toothpaste and not a colored one, because Sensodyne does have colored toothpaste and you don't want colored toothpaste while you're whitening. And just avoid food and beverages that are extremely hot or extremely cold. Mostly, again, that's just going to get the tooth kind of more stimulated or the teeth more stimulated until the sensitivity does subside. How long do results last? Results are generally stable for 6 months to a year, but I would say that that's going to definitely matter on your oral habits and your lifestyle. If you're a tea drinker or a coffee drinker, I have lots of light shining in. I'm so sorry. It's so sunny. You should have had this on the rainy days. If you're a tea drinker, tea stains teeth worse than coffee does. The tannins in the tea are awful. So tea, coffee, red wine, those kind of things are really going to increase the stain on your teeth. So yeah, basically it's more or less what people are doing afterwards that will indicate how long their whitening will stay. Lots of our patients find that once they have whitened, they will just do a touch up. Like they maybe like 6 to 8 months down the road, they'll just do like 3 days just to brighten them again and just remove things a little, remove a little bit of the stain, but you may not have to re-whiten like for another week or another whole office procedure for a year or more, right? Will my crowns and fillings whiten? The answer is no, they won't. So porcelain, veneers, or crowns do not change color unless you get a whole new one. And fillings or resins, composite materials do not change color either. So in the beginning, you know how I said that you had to do your fillings ahead of time? That was as if there's active decay, we can't whiten your teeth. But as far as if there's patients who come in and they want to change fillings on the front, because they, don't like the look of them anymore. If they're not happy with the color of their teeth, they should be whitening beforehand. And because then when we change the color of the fillings, then we're gonna match up to their new shade. As well as somebody who might want to have a patient who broke a front tooth, they don't like the color of their teeth, now they're having to get a crown. So before crowning, we did a whitening. So now we will just wait about a week or two before we would proceed with the crowns, because there is a rebound effect with whitening. And the rebound effect is just basically that your teeth can still whiten a little beyond your whitening time, and they could whiten and they could darken. I like to think of it a bit like a pore. So they're releasing stain, but they're also taking stain in. So again, what you're doing at home while you're whitening is to try to, help that along to go whiter and to not darken. But we do want people to have a little bit of time to stabilize before we're picking shades to match up a final restoration like a crown or a veneer. What do I need to do after I whiten? So pretty much you just need to use your recommended toothpaste and stuff, especially, for those immediate times of sensitivity wise. And I would recommend that usually to my patients, I ask them to avoid all food and beverage that is dark in color for 3 days post whitening. So if you're already done your final, you did an in-office and then your 5 days at home, now you need 3 more days past that before you're on to anything that has a dark color. Or the rule that I usually give them is if it would stain a white t-shirt, you shouldn't be having it. So that gets them thinking about, coffee as well as basically even spices and things. Like I've had patients say, oh, I guess I'm not going to be cooking with like curry for the next few days. And exactly, right? Just because it would stain. Will I look like a movie star? The answer is we don't know. So it's very important for people to feel understand the whitening, but you need to be very realistic, and you need to keep your expectations kind of, not too crazy, because people tend to look at shows like Friends and people's teeth are glowing and then they think that's going to happen, or that there's something about Mary and they just kind of think that's what's going to happen. But interesting fact though, teeth that do have shades of yellow to them do respond better to whitening gels than teeth that are darker, like a brown or a gray. They tend to not respond to the whitening agents as well. And those were the 10. A little quote that I like is, it says, visible from 200 feet, it is the intense focus of what other people look at and a sign of our warmth, confidence, and health. That's our smile, which we've all been missing under masks. And I know Steve had pointed out or said, you kind of got used to seeing people's eyes, that you would tell whether they were smiling, but it does truly make a difference when you can see somebody smile, because it is really a universal sign of people exhibiting happiness and warmth and greetings, right? List of my references, and that, in a nutshell, is teeth whitening.
Holy shit.
Any questions? I would like to know what your thoughts were. Steve, you were lost kind of there for a second. So I didn't know for sure if you had whitened. Have you ever whitened?
Oh, yeah, I got a whole new set. They're white. No,
There you go. So you whitened those ones you get to choose your own color.
he warned me, don't go because you can go bigger on the size of the teeth. You can go.
You
He
can.
said, and I've noticed other people that have dentures and they've gone way white and way bigger, and it just doesn't fit their head.
No, because then it might not look that natural.
But I'm laughing because I think we're all roughly the same. We're contemporaries in age, and yeah, I remember. And my ex Susie, her sister is a hygienist, and when whitening came out, when did this all started? Back in the
whitening's been around for as long as I've been in dentistry, so just changes over time.
Yeah.
In Carly's, you're using an in-office and you used it once. What's your feeling so far about using the trays?
It was really easy to use.
Mm-hmm.
Like everything, I'm not gonna lie, everything that you explained in your presentation, super useful, because some of the stuff I didn't have answers to those. So actually I learned so much from your presentation, and I'm like, oh, I should be using it multiple days at a time.
Oh yeah, let me
know that.
So I just realized, because there's so much whitening information, your results on whitening are better the more consecutive that you do it. So when I didn't
know that.
So when you're whitening, if you are going to whiten, that's the same as if we did the in-office and then we send you home with 5 days. I really urge people to use those 5 days. And even if you need to take a day off for sensitivity, if you do, that's fine. But whitening results will always be better if they're done as consecutively placed as they can be.
Right after Steve's presentation, you know what I'll be doing.
and for floss and brush ahead of time. Yeah. And removing your tray, just only wipe your teeth. Don't use any, crazy water, and don't brush. Because it's very, very aggressive or abrasive to be brushing right after a whitening treatment.
Yeah.
So you're better off to just wipe it away.
And then whatever's that's left is okay to like consume though.
100%. Yes.
Okay.
Yes. And usually too, if you ever have a whitening system that says that you're wearing it for 15 or 20 minutes, the active ingredient is really active for the time that
Yeah.
they're prescribing. So if
Yeah.
you were to keep it in for an extra 10 or 15 minutes, nothing's going to happen because
Okay.
it really is doing nothing.
Well, the one that I have, they're like half an hour to 1 hour.
Yeah. And so, and if for one time people used to wear them to bed, but they were concerned that they would sleep and then they're like, oh, that's 8 hours or whatever. But it really was if it was active for an hour, it was only going to be active for an hour.
Okay.
Yeah. Any other, Joni, your thoughts? I know you've used the Crest White strips. Anything you might consider trying?
Yes, actually, I had considered doing them at my dentist. So you've given, like Carly says, fantastic information. So something to consider a little further.
Yeah, to consider. Yeah, it's definitely come a long way. Like Steve said, it's it used to be, we used to use a system that the gel in the office was activated by a laser. And there still are systems like Zoom is a light, right? That activates in the office. It activates the gel in the whitening agent. The thing with heat and light is sometimes patients tend to report a lot more sensitivity. There's a lot more, it generates more heat and they feel that. So I find that a lot of these take-home trays or in office, if it's just a chemical activated gel, it tends to be a little more patient kind. So
I see. Okay.
yeah.
No, thank you.
Thanks for listening to my whole project on that. And hopefully, yeah, you might have gotten something.
Thank you.
And now it's going to be Steve's turn. Are you ready, Steve?
I had to switch laptops, believe it or not, I don't know why the video quit on that one. So
Okay.
But-
Are you okay to do?
yeah, I'm gonna I'm gonna go in and okay, I'll see you guys in a minute.
Okay.
right.
See you
See ya.
soon.
Everyone.
Okay, bye.
Bye.
Bye. Oh, what happened there? Ah.